Amid a sharp spike in HIV cases, the Meghalaya government has decided to adopt a mission mode approach to combat the spread of the disease, beginning with East Khasi Hills. At a high-level review meeting held at the State Secretariat and chaired by Deputy Chief Minister Preston Tinsong, the Deputy Chief Minister and Health Minister Dr. Ampareen Lyngdoh engaged with MLAs from the district to discuss the alarming trend. East Khasi Hills alone has reported 3,432 HIV-positive cases, with a doubling trend in recent years. However, only 1,581 patients are currently availing treatment, raising concerns over follow-up and stigma. Lyngdoh stated that the government will now move beyond awareness campaigns to strengthen testing, treatment and policy intervention. She also indicated that a cabinet note is being prepared for a comprehensive HIV control strategy. District-wise consultations will continue, with Jaintia Hills and Garo Hills next in focus. The meeting was organized by Meghalaya AIDS Control Society in collaboration with National AIDS Control Organization and the Health and Family Welfare Department.
The meeting obviously is related and linked directly to the increasing numbers of HIV/AIDS in the district. We will be going from one district to another. We've just completed the East Khasi Hills meeting today, and we will likely be having the West Garo Hills meeting in the leadership of Honorable Speaker himself. I had spoken to him. He was in agreement. Today's meeting came up with a very strong resolution. This resolution hovers around the importance of having a mission mode redressal by the state government itself to combat these alarming increases in the HIV/AIDS numbers in the state of Meghalaya. We will not share with the media the hotspots because we believe that in a bid to ensure that stigmatization does not occur, we will not isolate individual constituencies and their numbers, because that directly points to indicators which may reach to stigmatization. But let me tell you, for East Khasi Hills, the numbers alone are very big. We have also problems with Jaintia Hills, but we will deal with the Jaintia Hills numbers when we reach that stage with the MLAs, the DCs of Jaintia Hills. But in Khasi Hills alone, these numbers have doubled to a huge number of 3,432, which is double and doubling every year. We have to address this problem. Unfortunately, out of these 3,432 already tested HIV/AIDS positive citizens, only 1,581 are coming forward for treatment. We've had a loss of follow-up of 681 out of this 3,432 numbers. Now, this is not a good trend because it is indicative of a very serious pandemic that can envelop our communities across the state. You will not believe it that as of the last few years, I don't have the exact figure, but the figure of 159 deaths due to loss of ART treatment is huge in the district. We have to make sure that everyone, at least who has been tested, comes into the system for necessary treatments. HIV/AIDS is actually not fatal, but it can be treated like cancer, like TB, like any other disease. There is a treatment protocol in position and in place Now we just have to tell people that they have to come forward to test themselves. What is happening is that we are afraid that despite the fact that these numbers are huge, there could be more people in the communities around us who are not coming forward. So in the state of Meghalaya, as of today, it has been identified that prevalence of HIV/AIDS or spread of HIV/AIDS is predominantly due to sexual interactions. So we are different from certain stage where they have reached to that stage where injecting drug users and sharing of needles is a big component. In our state, we have not even been able to identify injecting drug users and prevalence of HIV/AIDS because we are not able to test citizens correctly. So this meeting has given the resolution today that government of Meghalaya has to get into a mission mode to redress the spread of HIV/AIDS. The Department of Health has been tasked by the MLAs that attended today to come up with a cabinet note to envisage a comprehensive policy on a mission mode to redress and address the spread of HIV/AIDS.